So welcome back. So just to recap about the pancreas, remember it's about the size of a human hand. It lies right in the middle of the body. It has both endocrine functions and exocrine functions, and its job as an exocrine gland is to make those enzymes that break down food and also to make that bicarbonate to neutralize that stomach acid as it comes into the intestine. When the pancreas is diseased, it is called pancreatitis or inflammation of the pancreas. And if it happens over and over again, it is called chronic pancreatitis. It can be very painful. It can cause a lot of nausea and vomiting, also because of its location. The causes of pancreatic disease, well, the first one is much easier to understand now. It's called gallstones because remember, the pancreas shares that tube with the gallbladder as it goes into the intestine. So if there's a stone blocking that path, then those enzymes will back up and cause swelling. The second is alcoholism because it activates those enzymes in the body of the pancreas before it can go down into the tube, and it can actually eat away at the pancreatic tissue a little bit. Certain medications, certain infections can bother the pancreas, but also a high fatty diet because now the pancreas is working overtime. The pancreas can also get cancer. It is very rare. Only 100 people who have cancer, only 3 will get the pancreatic cancer, but it is very hard to treat. The risk factors for pancreatic cancer are increased age, but also smoking. And in fact, 25% of those patients with pancreatic cancer are smokers. And sometimes they can run in families. Obesity and diabetes can also contribute. The way to diagnose pancreatic disease is to measure certain blood tests, sometimes certain scans, sometimes certain scopes are needed. Now, the way to treat pancreatic disease is difficult, so actually prevention, even though it is hard, is probably easier. So avoid that smoking, avoid the alcohol, and avoid those high fatty foods. But when a patient does get pancreatitis, usually they're hospitalized so that they don't have to take anything by mouth, and they're given everything IV so that pancreas can get a complete rest and can recuperate. Sometimes there are pain medicines, IV medicines that can be given, but also pills that will then take over for the pancreatic enzymes and help the patient digest the food better. Now, even though pancreatic disease can be very hard to treat, it is at least worth a try because it can make the patient's life better. And as Peter Parker said, no one can win every battle, but no man should fall without a struggle. Until next time.